Hello, I'm Bill Terra. For over 50 years, I've been active in supporting medical freedom. I firmly believe that everyone should be able to make informed decisions for themselves on the use of drugs and medical procedures. I consider this to be a basic human right. Over the past year, an interesting social narrative has been expanding and gaining force. It's this: if a person questions the use of the current vaccines for COVID-19, they're either an anti-vaxxer or they're anti-science. These knee-jerk responses are leveled even if you're not against vaccines or science. This is not a new attitude. It's being built on a foundation of fear and a very limited perspective. There are valid reasons why a person might have reservations using many, if not most, drugs. All major pharmaceutical companies have been found guilty of dangerous fraud over the past decade. 3 of the biggest have paid out billions in damages. GlaxoSmithKline was fined $3 billion in 2012. Johnson & Johnson and Pfizer both paid out $2.3 billion each in the past decade. A third of new drugs in America are recalled for safety reasons by the FDA after being approved, and most of the recalls happen when the drug has been on the market for 4 years. Most of them were drugs that had been granted accelerated approval. Does this sound familiar? Is this important? I think so. To question products supplied by these companies, especially those rushed to market, seems logical to me. Modern culture is driven by the search for a new drug for every problem. 48% of Americans use at least one prescription drug, and 24% use 3 or more. 6 out of 10 U.S. adults have a chronic disease, and 4 out of 10 have 2 chronic diseases or more. And 43% of the population is obese. One thing that we know is that this virus and any viral infection is worse and possibly fatal with obesity and other comorbidities. If our healthcare systems are so good, why are we so sick? Is this important? I think so. There are 2 big questions we're avoiding. They're uncomfortable questions. The first is why there's not the same enthusiasm about preventing disease and building immunity in the population as there is to medicate it. Is this all down to profit and the maintaining of the status quo? It may seem like it. The second question is about the creation of zoonotic disease. We know that most of the viruses we have encountered over the past century have originated from animals. We know that our demand for animals to eat is driving even greater pressure to concentrate animal populations. This creates a perfect storm for virus growth. We need to stop our reliance on animals for food, and we need to do it soon. The job of any virus is to mutate. Are we simply going to continue our present plan and stagger into the future with one drug after another? I hope not. Finding tools to create a healthy society will not come about by superficial labeling. It requires a deeper conversation. Thank you for listening.